after, and we like to do that. So she's a remarkable individual. So good. Yeah.
I think I'd like to say a few things. So, first of all, this is very humbling, a bit overwhelming. I'm not sure you all know, but I don't really do well with these things. I am very thankful to Marjorie Johnson for actually providing the funding and the foresight to enable me to do this, because I think with her generous gift to Cincinnati Children's, we will be able to further our work with vascular anomalies and vascular tumors. And so with that said, this chair really isn't about me. So this chair is really about you all. So we are who we are surrounded by. And I could not be more thankful to be surrounded by such wonderful, great people that are out there today. We work hard, we do play hard. We take our work very seriously and hopefully don't take ourselves too seriously. But I could not do all of this without all of you, without the nurses, without the other physicians, without all of the people that I come across working here, my patient satisfaction people, all of my peers, my HVMC people, my friends, my colleagues, the hospital operators. I mean, there are too many to name, but you are all the reason why I have accomplished what I've accomplished. And just want to talk about just a few people. So, yes, Dr. Ware has been an unbelievable mentor to me. I mean, how lucky was I to not only find such a great clinical mentor, but such a wonderful mentor who could actually do basic science. You have to remember, when I went into the lab, I didn't even know what a pipette was, let alone how to use it. And he and Thad taught me everything I know. And he did teach me how to be a good mentor. He taught me how to be a good teacher. He did in our lab, and I don't know if he remembers this, but not only when I was in that hotel room practicing my talk, but we practiced talks to our lab over and over again. And if we said or if we did something else incorrect, we had to do it over again. And I am so grateful for that, and I tell my fellows those stories all the time, because he is one of the reasons why I'm where I am today. And I'll never forget, one of my talks that I had to give when I was a fellow was on genomic instability in patients with hydroxyurea, and I was a nervous wreck about giving this talk. And one of the attendings came up to me afterwards and said, "You sounded just like Russell Ware." And all I could say was, "Wow, maybe I've made it." So that was a big deal. Rich Azizkan, who he said we met at a meeting, I knew that when I was going to a venue on a bus with him and he was talking about his special child, that he was a special person. And that was very important to me. John and Stella and all the people who actually attracted me to this program, and who really we were friends when we got here. We still are friends now, but it was, we didn't have any family here, and there weren't a lot of other people who had arrived yet, and so we all depended on each other. And it was a wonderful experience to have that. My peers, all of you, my brother, my adopted brother Brian, who has really helped me a lot, especially in a very hard time during my time here when my own brother died. Brian was there for me. Mike and Maureen and Trent and Karen and everyone, Raj, all of you have really helped me, because you've put up with my bipolar oncology, little hematology, I do love hematology, and also my vascular program. My patients are the most important thing to me. Some of my patients, even though they've been through hardships with their children, have supported the programs that I'm doing, and that is, I am indebted to all of you, and there are some patients and their families that are in the room today. I'm trying to think of all that. I feel like I'm up in an Academy Award, but I need to say thank you to everyone. My vascular team, and just so people know, could my vascular team, anybody who, my vascular team has really just been tremendous, and they have enabled me to meet so many people in this hospital. So I see surgeons here. Manish, stand up for just a second so that people can acknowledge. So my mom can see who you are. Come on, stand up. Everyone who's in the right place. Tremendous people. And of course, I want to thank my family. So people don't know, but I cry even when I see a Hallmark card commercial, so I'm trying not to. But my kids, Keenan, Caitlin, Rebecca, and Emma, it's been really hard for them. I am a very dedicated to my job, and there's been a lot of times that I haven't been there at things when maybe I should have, but they've been there for me. And they've been there eating dinner at 8:30 and 9 o'clock at night so that we could be together. And they've had to put up with me standing on the kitchen chairs and talking about careers and how important that is for people. And then lastly, the rest of my family who are here. I have my Aunt Denise is here, my sister Jean Marie, and my mother. And of course, I couldn't have done all of this without my husband. So my husband has been just a wonderful support. We actually call him Mr. Wonderful, and that truly is a term of endearment. Amazing honor, and really it wouldn't have been, I wouldn't have been able to do all this without all of you. So thank you very much.
So, unveiling of the chair, and then there'll be a little reception outside where Denise is, this is the Marjorie Johnson chair plaque that will go in all of the Endowed chairs at the main building. We want to thank you again for your support of an extraordinary individual and for coming today. And as I was mentioning, we'll have a short reception, and Denise will be putting the plaque up outside outside the room right now. So thank you again for coming, and thank you again to Dr. Ware for the coming visit.